in this evolving pandemic, it became clear to us that clinicians who are working in specialties where we're using drugs that modulate the immune system, either by suppressing immune responses, of which there are many different types of drugs that do that, or in some circumstances, for example, in cancer medicine, by stimulating the immune system, that we needed to see what information was out there in the literature around high consequence coronavirus infections like SARS and MERS in general, and specifically around the data that's emerging for the COVID-19 pandemic. So our cancer epidemiology team here at King's College London used a systematic review approach. So they established search criteria for a series of different classes of drugs or drugs that the clinicians within Guy's and St Thomas's and King's College London felt were relevant for being looked at. And then they systematically reviewed the literature for high quality research that addressed the questions that we were trying to answer. So we looked specifically at cytotoxic chemotherapy, also at classes of immune modulating drugs such as biologics, particularly tumor necrosis factor alpha binding antibodies, JAK2 inhibitors, which are immunosuppressive drugs used in different clinical specialties, mycophenolate mofetil, tacrolimus. We also looked at anti-CD20 antibodies. And the team then went through and looked systematically to see whether there was any evidence that the use of these drugs was associated with harm or potential benefit in the management of high consequence coronavirus infections. I've also, off that list, I've missed off, looking very importantly, we looked at steroids, low dose immune modulating steroid doses, and non-steroidal anti-inflammatory drugs. So I think it's really important to acknowledge at this point what we know and what we don't know. This is a new infection and information is emerging constantly and our understanding is growing constantly. So what we do know about COVID-19 is still relatively limited from the data sets coming from China and Italy. We know a bit more about other high consequence coronavirus infections. And so I think the message that's coming out of this systematic review of the literature at the moment is that there is actually very little evidence to suggest that the use of these immune modulating drugs, including cytotoxic chemotherapy for the treatment of cancer, is associated with increased risk of harm with high consequence coronavirus infections like COVID-19. And there is some evidence that the use of some of these drugs could potentially be beneficial. One of the reasons that the theories why this may be the case is that there's clear evidence from patients who become very unwell with COVID-19 that overactivation of the immune system and a sort of a cytokine release syndrome leading to harm within the lung is associated with some of the risk of severe morbidity or mortality for patients who are unwell. And so perhaps modulating the immune system may be a good thing. We don't know the answer to that, but certainly from the literature review that we've put together, it's very clear that there is no evidence that these drugs are harmful in the context of Corona-19, nor is there any real evidence that they're beneficial yet. We need more research to answer these questions. So I think one of the most important messages is that right now there isn't evidence that we should be. So inevitably, because of the concern about the peak infection and lots of people becoming unwell at one time, a lot of effort and planning has gone into making sure that we have capacity to care for patients who become sick with COVID-19. And as a consequence, we have been reviewing and scaling down our cancer services over the past few weeks to make sure we can continue to deliver the care that we need to patients who need it, whilst minimising risk to patients who may suffer more harm than good by coming to the centre to receive cancer care at the moment because of the pandemic. So I think in the cancer space, I think that's the one thing to say, that changes have had to be made to try and make sure that we can continue to deliver service at this really unusual time. With respect to immune modulatory therapy for other conditions like inflammatory arthritis or inflammatory bowel disease, or the use of low-dose steroids for managing the side effects of some cancer drugs, there is really no evidence at all that we should be changing the way we use those drugs. And I'm hopeful that this review will help clinicians working with patient cohorts who are on those kinds of medications to be confident and to give those patients confident advice that they should continue taking their therapy for their diseases, because it's really important that we continue to care for patients properly while also doing everything we can to manage the risk associated with this pandemic. I think we need to do more research. I mean, I think that has to be the conclusion of anything, any work, any review of the literature that we're doing at the moment around this pandemic. We need to all be collecting data, and then we need to be sharing that data so that we can continue to understand how best to care for our patients through this pandemic, and potentially, therefore, how to care for patients in the future if something like this should happen again.